Good afternoon, everyone. This is session IC12, Camber, Degrees of Performance. My name is Julie, and I will be moderating today's session, and I will provide the CEU code at the end. Before we get started, please remember to mute yourself, and questions can be asked using the chat feature at the bottom of your screen. I will go ahead now and turn it over to Christy and Erin.
Hello, everybody, and welcome to Camber Degrees of Performance. My name is Erin Maniaci, and I'm joined here with my coworker, Christy, and we are so excited to be here today on behalf of Motion Composites, presenting to you all on Camber.
Hi, just a real quick introduction. My name is Christy. I'm a physical therapist. I live in the Detroit area. I've been a therapist for about 20 years. I did almost 2 years working as an ATP for an independent dealer in Michigan. And I currently do full-time education for Motion Composites. So we're so thankful that you guys have joined us, and we will get to it.
Awesome. And I'm Erin Maniaci. I'm also a physical therapist. Got most of my clinical experience in spinal cord injury rehab in the inpatient setting, and now am a clinical education specialist at Motion Composites, based in sunny Phoenix right now, which has been really nice with all the snow that's around. And I'm a disgruntled Chiefs fan today, but that's okay. Congratulations to Cincinnati. They have not gone to the Super Bowl since before I was born, so I think they deserve that. So cheers to you guys, Cincinnati fans. All right, so greetings from Motion Composites. We didn't want to start the presentation today without giving them a big shout out. Here are a couple of our accolades and accomplishments over the last few years. If you are not familiar with Motion Composites, we are an ultra lightweight manual wheelchair manufacturer based in Canada. So just greetings from all of us at Motion Composites, and we'll get started today. All right, so our learning objectives. By the end of this course, we want you to be able to explain 3 benefits and 3 limitations of the cambered rear wheel on a manual wheelchair. And we know that a lot of times we speak about cambered wheels in terms of the athlete population and with athlete chairs. So today we're really going to focus on, and hopefully you guys can be able to explain to populations outside of the wheelchair athlete that can benefit biomechanically and with efficiency with a cambered wheel. We like to start off all of our presentations with this slide just to kind of refocus and recenter ourselves, to realize that everything we're presenting today and everything that we kind of start with is rooted in evidence, but also realizing that with Christy and myself and with each of you, you guys all come with your own clinical expertise and clinical knowledge, whether you're a clinician or a provider, supplier. We all have our own expertise in the field. So combining those with the patient value and the individual client need is going to bring the best practice for our client, specifically today in wheelchair prescription. So just want to know that everything we do present today is rooted in research and evidence. But we want you to be able to kind of extrapolate what you need from this information and apply it to your individual setting. So before we get started today and we dive into Camber, everything that we're talking about is really to improve efficiency of the client in the manual wheelchair. And for the purpose of today's presentation, we want to assume that we already have a properly configured manual wheelchair. So that is in regards to width and depth. The seating is really honed in, the wheelchair positioning of the rear wheel, of the seat to floor height, caster size, all of those things we really have dialed into a particular client. And then we're going to introduce Camber as another topic. It is just one component that plays into proper configuration, and we're well aware of that. So today we're just kind of giving you some tidbits on how to interject Camber into that conversation. Okay, so seat slope, back angle, all of those things are really dialed in. And we're always thinking about shoulder health, obviously shoulder preservation, upper extremity preservation when we're talking about manual wheelchair users. So the setup is very, very important, and Camber is just a piece of that. So let's start off with defining camber. So camber angle is the measure in degrees of the difference between the wheel's vertical alignment perpendicular to the surface. The picture does a great job of explaining what that means. Wheelchairs without camber, or can be referred to as with zero camber, is pictured on the left there. And then a wheel with camber, where the top of the wheel is, the distance is shorter than the bottom of the wheel. That wheel comes out wider at the bottom. That's referred to as negative camber. In other industries, they will use what is called positive camber. And we'll get into that here. So negative camber is used in our industry in wheelchairs. It's also used in the automotive racing industry. Positive camber is used in all-terrain vehicles, construction equipment, really all to say that those different industries are going to use it to their mechanical advantage, to biomechanical advantage in our case. Some people want less friction, some people want more friction. And so we can get into the physics of that, but not today, not during this hour. But just realizing that when we are talking to our industry and about our industry in wheelchairs, we're speaking actually of negative camber, even though the degrees are actually in a positive, they're displayed positively, but it's actually negative. So within our industry, just to kind of give you, speaking in general terms, if camber is new to you or manual wheelchair prescription is new to you, everyday wheelchairs, kind of that average for a folding chair, can range from 0 to 6 degrees. Rigid chairs can range from 0 to 8 degrees. 2 to 3 degrees is kind of that common for an average user. Sports wheelchairs will go on to that more dramatic camber angle, 15 to 24 degrees. Today, again, we're going to really focus on that everyday user. But knowing what's out there, knowing that different manufacturers have different degrees of camber. So even though they range from 0 to 6, 0 to 8, some chairs are non-adjustable. So some you pick your exact degree you want. Some of those ultralight wheelchairs are going to be adjustable, so you can adjust that camber down the line if you need. And then some are going to come in even increments. Some are going to come in odd increments. Really just depends on the manufacturer. So knowing exactly what you're dealing with when you are prescribing is important. So like I said, can camber be added to my client's wheelchair? First, not all categories of wheelchair have camber as an option. So in the United States, we refer to it as a K5, but in other industries, ultra lightweight manual wheelchairs, they're the only chair that you can have camber. So any of those lower level manual wheelchairs, camber is not an option. That's where you can start getting into the funding conversation. And if you do need camber and want to utilize camber for your client, we can use that as a funding argument, and we'll get into that later. Again, not all wheelchairs can be modified after delivery if you don't have that adjustable option, but some models you can have adjustable options, and so you can add that later. This can help you with your client when you guys are deciding what manufacturer you want to go with. If they don't know for sure and they might want to add camber later, then you want to go with something that is adjustable down the line. Otherwise, they might really, maybe this is their third, fourth chair, they're super dialed into what they want and what they need for their function. So they know exactly what camber angle they want to go with, and they don't need an adjustable option down the line. So when you are talking about adjusting camber, again, asking your manufacturers kind of what their options are, especially if they come in for a lunch and learn, or you have a relationship with that sales rep, you want to ask them kind of, is it easy or hard? What additional tools, additional parts may I need to adjust camber on these certain chairs? So asking those questions is of course going to be great. Manufacturers are going to have schematics and images like this on their website to help you or to help techs and things like that in the industry be able to interchange camber tubes and plugs. It's going to differ between that foldable or the rigid wheelchair. So foldable, you can adjust camber through the axle plate or the axle receiver, whereas a rigid wheelchair, they might adjust through a plug or an insert into the camber tube, or they might just have you replace the entire camber tube itself. Again, manufacturers differ, and knowing the difference can sometimes help you make that decision on what's best for your client. So let's get into some of the benefits of camber now that we have defined it. Camber is going to give you an increased mechanical advantage. It puts that hand rim at a better position for a more natural push stroke by the user. It allows them to push down and out, so it improved body mechanics with that push. We are in the business, if we're talking manual wheelchairs, ultra lightweight manual wheelchairs, of prevention of upper extremity injuries. We want to prevent that injury from occurring, knowing that almost 100% of manual wheelchair users, as research tells us, are going to be dealing with an upper extremity injury, shoulder injury at some point or another. So the more that we can improve mechanical advantage, improve body mechanics from the start, the better off we're going to be as we go. We want more fluid motion with the upper extremities. We want to do proper training for propulsion to reduce shoulder strain over time. The camber and that angle is also going to just decrease overall shoulder abduction because it brings that wheel closer into the user. So the more things we can do to increase mechanical advantage, the better. Lots of benefits there. Increased efficiency noted as well. So rolling resistance is going to be reduced, increased turning efficiency, especially at those high speeds, keeps your tire and your rim in alignment when you have camber. Thin, high performance tires are going to perform better with camber than a knobby tire or a thicker tire. This is something that we can certainly touch on as well. You know, camber is one aspect of component selection, but so are tires, so are hand rims, so are wheels. So knowing that tires can also very specifically impact the efficiency of the wheelchair is going to be important as well. And so we're always educating our clients on, if we're going to go the cambered route, what kind of tire is going to perform best for you. Of course, that's a whole other conversation that you can get into, taking into account, more or less maintenance over time. So definitely more components, and there can be a presentation on each one of those. So moving on, in terms of increased efficiency, camber redirects that force coming up through the wheelchair from the environment. All to say, it just reduces and disperses road noise. We talk about this a lot with material of chair or with style of rigid chair. You can have that box frame, the cantilever frame. If reducing road noise and dispersing road noise is super important for your client, somebody with lots of neuropathic pain, or they just don't have the tolerance to sit up all day, so you're just improving that over the entirety of the day. If you can disperse more noise with camber, adding that in can make a huge impact on function. If we revisit that first bullet point, so rolling resistance is reduced. It's reduced up to kind of that 9-degree mark is what research is telling us. So you can kind of picture that at 0 or no camber, the entire bottom of that wheel is kind of in contact with the ground. You're getting a lot of resistance, the most friction. But as you angle out and give a little bit more camber up to that 9 degrees, less and less of that tire is in contact with the ground, overall reducing rolling resistance. As you get up above 9 degrees, then you can start getting a little bit more increased resistance, and that gets you kind of more into that sports world. But clinically, asking yourself, what kind of environment are they traversing? Carpets, tile, uneven ground, all of those are great questions to be asking when you're selecting camber or tires for that matter. Another great clinical benefit is hand protection. And I think this is something that isn't really necessarily in the research, but certainly brought to our attention by end users and by clients. Because the bottom of the wheel is wider, it's going to contact a lateral obstacle before the user's hand and fingers. So a narrow doorway is a perfect example of this. That's going to save their hands. Let's think about hand protection in terms of geriatrics, people with decreased sensation, just an average user with a history of injury. So those are great things to think about. And of course, in our geriatric population, our skin integrity isn't going to be as great as it once was. But also just thinking about our user and our client, they're relying on their hands for everything, propulsion, all of their ADLs, all of their movement throughout the day. So bumping their hand or, having a cut or a bruise, that's going to affect them so much more than it would an able-bodied person. So hand protection is super important for these folks, and camber can give them that benefit. Another benefit of camber is improved stability, and that's just, it increases the lateral stability because it increases the overall footprint of the wheelchair in the width of the chair. So you can improve your navigation over lateral slopes or traversing lateral terrain. It improves your handling during frequent sideways movements. If you're, say, going up a steep slope and you need to take a rest, you can turn sideways without feeling like the chair is going to tip over. But this brings up, obviously, probably the number one limitation of camber, right? The increased width. So that will lead us right into our limitations. Number one, increases overall width. So you can basically bet you're approximately gaining an inch for every 2 degrees of camber that you select. The overall bottom, again, is going to increase, not necessarily the top of the chair, but the bottom footprint's going to increase. And then manufacturers sometimes will have what we call a width calculator or something similar to that effect on their website. So you can type in exactly the dimensions of your chair, and Christy will get into this later, but it can show your client, this is the things we've selected, this is how wide your chair is going to be, and then you have like an exact number and they can go measure things in their home if they need to. Another limitation with excessive camber may cause the wheels to rub against other components of the chair, like the armrest or the side guards. So knowing, depending on how significant your angle with camber is going to be, knowing what other components you've selected to know if it's going to rub or, get in the way of other components on the chair. As an ATP, certainly want to recognize these things. As a therapist, you may not know the exact dimensions of everything, but manufacturers and things can also flag this as, hey, your camber angle is a little bit more significant than we've seen. So you may have issues with this particular armrest or this particular side guard. So the more you prescribe certain manufacturers' chairs, the more comfortable you'll get with knowing these types of things. Another limitation, and we touched on this, is decreased surface contact area between the tread of the tire and the road. So sometimes you might want this, but sometimes this can become a limitation. So reduced traction depending on the type of tire that you have and the degree that you have of camber can be harmful for some end users. It can also cause uneven tear or wear on the medial side of the tire. It reduces overall traction. It can cause sinking into soft terrain. So again, you're just having those conversations with your client. What type of terrain, what type of ground are you going to be going over? Knowing that more camber may actually limit them in certain areas. And if they're not going to be doing any of those soft terrain or things like that, adding a little bit more camber may be beneficial to them. Something that we really want to take our time on today and put out into the universe, put out into our wheelchair industry is toe in and toe out. And we're specifically talking about wheel alignment here. This is something that is only applicable to a cambered wheel. So if you have no camber or zero camber, you aren't worried about toe in and toe out. So we'll define it, kind of show you what it might look like clinically. To notice maybe I need to mess with the toe in, toe out and really pay attention to the wheel alignment. But wheel alignment, as defined, is the parallelism of the wheels between them and that central line of the chair as viewed from the top. So we are looking kind of at that bird's eye view of these 3 chairs here, A, B, and C. That dashed line through the middle, that is going to be the central line of the chair. So if both wheels and the central line are parallel, then you have no toe, and that's optimal for performance. It's when you get toe in or toe out that efficiency can be harmed. What might this look like clinically? Like, how do I sniff this out if I have a client that comes in and is saying things like, I hear something audible when I'm rolling across the floor. I have some scrub when I'm propelling. If you have any toe in or toe out, they might describe it as they can feel some drag. So this is one of the biggest adjustments that we can make for performance of the chair. Maybe if your client isn't really that active, but they keep coming in, their tire is worn out very unevenly. One of the options could be that they're experiencing toe in or toe out. just know that that can kind of open Pandora's box. There's many factors at play that can cause this. Camber tube may be offset. It's not just the wheel alignment. So finding other problems that could be present can be a bit of Pandora's box, but just having this in your back pocket, having this in your toolbox, knowing that toe in and toe out and wheel alignment can be affected, can help you become a better clinician or a better provider. So let's get into a little bit more definition. So this is an example of no toe. The distance between the rear of the tires and the front of the tires are equal. They might say rear wheel parallelism. That is very difficult to say. Proud of myself there. And it's really defined as within 6 millimeters. That can be categorized as no toe. But if you talk to an end user, if you talk to a client, that typical distance between the two is like a hair of a toe in. So 1/32 of an inch, less than a millimeter. Okay. So very, very close to equal. 6 millimeters gives you kind of a wide range. But the central axis of the chair, that dashed line, that can be really hard to measure, especially with all the different components that we put on the chair. So many will actually measure from the outer edge of the frame to the inside of the tire to compare the distances that way. So we have a picture here out in the field. If you're like, okay, how do I measure for toe in, toe out? This is a great way to do it. Again, outer edge of the frame to the inner edge of the wheel. You're measuring the front and the rear, and then you're doing the same on the left and the right sides. You're comparing left and right sides. And again, you want those to be as equal as possible, front to back. When somebody's experiencing toe in, that means the front wheel distance is less than the rear wheel distance. This is inefficient. There's going to be no glide with propulsion. But if you're going to err, if you're messing with alignment and you're going to err, you would want to err on the side of having a little bit of toe in over toe out. Toe out is just the opposite. So the front wheel distance is greater than the rear wheel distance. And this picture, I think, does a really good job of showing that, because we can see the inside of the rim here on the back of the wheel. And ideally, the tire, this front tire, would be covering up the inside of the rim here. That would be an example of no toe. So here we're seeing toe out, definitely more inefficient than toe in. It's the slowest of the two. You're going to get the most drag, no glide with propulsion again. But let's talk about toe out maybe in a little bit different light. So even if you don't have toe, you have no toe in or toe out can occur naturally when an end user or when your client is doing a wheelie. So a wheelie is a very normal wheelchair skill that your client may use when they're traversing down a hill. So going down big hills, not only does that wheelie provide some assistance with their trunk, and maybe they feel better doing the wheelie so they are not falling forward going down the hill, but it's also actually giving them a little bit of toe out. So that can be an advantage when traversing down a hill. And this just kind of gives you a background as to why that might help. So toe out is going to give you that added benefit of braking, a little bit of giving you a braking effect to control your speed with descent. So even if you don't even have toe out, when you are looking at your alignment very carefully, toe out can occur naturally with a wheelie. And you might even educate your client to do that, to get some toe out for the braking effect. So ensuring alignment, if you have a folding wheelchair, if you have a rigid wheelchair, and also again, depending on the manufacturers, it's all going to vary. For a folding wheelchair, ensuring that the axle bushings are the same length bilaterally. For a rigid wheelchair, ensuring that the camber tube is again symmetrical, looking at the axle bushings on that chair as well. You want to make sure they're the same length bilaterally. Here we have just some pictures of what the camber tubes might look like here when you're installing. Again, manufacturers will have technical manuals and instruction sheets on their websites to kind of give you a very detailed description of how to realign their unique parts. But just caveat, I would not, mess with this if you're very new to alignment, I definitely leave this up to a dealer or somebody who knows their way around rear wheel alignment, because it can just be so specific. And if it's off, the client's really going to notice. So with your plugs, if you're changing out a camber plug, they recommend changing one at a time, aligning one with the chair center line. Again, that dotted line that we showed visually a couple slides ago. As long as one is in alignment, then at least that one will stay consistent to avoid pulling to one side. So they recommend not doing both at once. Making sure you have your wheel locks off, because if you have those wheel locks on, the tire pressure can interfere with alignment if they're engaged. So positioning your wheels between blocks to ensure that the wheelchair stays still when you are messing with alignment. Again, getting out those technical manuals so you can learn. But alignment is just as detailed and individualized as any other aspect of the wheelchair. So we started this presentation talking about having everything else dialed in, having the seat slope and all the seating and the backrest. All of that was super dialed in. Then we talked about camber and alignment, and just knowing that all of this is very individualized for every client. There's really not one size fits all. We can, talk to you about what's typical in our industry, but knowing each individual's environments and what their functional goals are, listening to your clients' wants and listening to their priority list is going to be super important when we're ultimately deciding what camber is best for them. So I'm going to hand it off to Christy. She's going to talk a little bit more about some science stuff. I know we did a lot of defining in my portion, but then she's going to talk a little bit more about reality and how we can apply this to our end user. So thank you so much.
Thank you. 1 second. Can you see my screen? Okay, perfect.
Yeah.
Just really quick, I just apologize for the handouts. Someone is going to try to take care of that and drop a new handout into the chat. If not, you can email us at our email address and we'll get you the handouts. Thank you for giving us all that information, Erin. We're going to kind of look at some of the real world examples of what we're doing now that we've gone through a lot of the what is out there in Camber. So we spent a lot of time looking at benefits and limitations, trying to figure out Camber for everyday chairs, right? So we can say that there's improved mechanical advantage, there's improved efficiency, improved stability. A lot of this is coming from the research that's been done on athletes, okay? There is limited research on Camber in everyday chairs. So then you're asking, okay, you said you're research-based, where did you get your research from? Well, it has to be extrapolated, right? We do that when we look at things because there isn't always something specifically researched on the process that we're doing. And so it's important to see what is out there and read it with some discretion. So a lot of the studies consist of subjects that are either able-bodied or wheelchair athletes, or they have a very small number of participants. So if there's any researchers out there that are like, hey, I want to do something on wheelchairs and Camber grabs your fancy, go right ahead, message us afterwards. I'm sure we can hook you up with somebody willing to do some research looking at Camber specifically. Okay, so one of the main studies that looked at Camber in everyday chairs is this one here that we're just going to discuss just briefly. Again, I don't consider myself a researcher, but again, we're just trying to discuss what is out there so that we can help our clients make the best decision that we can. And so this one, I kind of like it because they did use disabled experienced wheelchair users, non-disabled experienced wheelchair users, and then non-disabled inexperienced. So there was a wide variety. They looked at 0, 3, and 6 degrees of camber. They had them rate stability, maneuverability, comfort, overall preference. And it was very interesting to see. They also had the clients rate or to do ratings of perceived exertion and looking at VO2. And so they didn't find any differences in those cases. So they didn't see any differences in ratings of perceived exertion or in their oxygen uptake. Everyone said that they liked 6 degrees of camber. So it really came down to patient preference. And so I think, when you're not dealing with a lot of increase in rolling resistance, we're not going over that 9 degrees, it's okay to maybe let our clients try a few and decide what works for them. Before you get all up in arms, I promise you, I'm not saying that every supplier and every rehab facility has to have 6 different chairs with 1, 2, 3, 4, 5, 6 degrees of camber. No, let's back it up and let's have a real discussion about how to apply these things in our everyday. Okay, right, because we have a lot of numbers, degrees, considerations, kind of milling around in our heads. And we want to make sure that what we're presenting today is something that you can take back in your next wheelchair evaluation, whether it's tomorrow, whether it's next week, whatever. What is going to be useful that I can take away from this? Every time I go to a presentation, I'm always trying to say, what is that 1 or 2 things that I can take away to have this discussion with my clients? So we're going to start with who benefits from Camber. So Erin did a great job of going through the benefits and the limitations. And we really want to see who's going to benefit from that. Okay, so the next several slides are a little bit more wordy, but we're leaving it there so that you can have it as a resource to help you maybe justify for a specific population. But who does benefit? We've got the average user. In a minute, we're going to really look at that average user and kind of dive into that terminology. The athlete, I think it's pretty obvious. Anyone who thinks of Camber, I think first of all, 2 athletes. The aging client, I think often underserved could be the aging client, especially in this ultra lightweight manual wheelchair category. The pediatric client, we'll talk a little bit about that. And then the pear-shaped client, quite typically a female client, but again, just a pear-shaped client. So we want to look at all of that and see how each one of these different populations can benefit from adding a little bit of camber into their wheelchair. 1 second. So I said average, and then you come to his, it says active or average. Really, where is it? And what are we trying to say here? So there are a lot of funding discussions out there that talk about ultra lightweight wheelchairs, and the term active user is often in there. And this typically, if I was to ask a lot of the people on this call, they would say, well, this is the young, active adult, new injury that's going to try to regain their independence. Well, I'm going to challenge us to retrain our thinking, right? Let's redefine active user. And what does it mean to be active for your client, for this specific client here today? Again, don't let the term active or highly active be used to discriminate against your client. I did some reading trying to, find what is the actual definition of active, and it doesn't exist. And so it's there to allow you to use it and help your client to be as active as they can be. So these examples here on this page, a 65-year-old grandparent who babysits once a week. Well, it's once a week. Well, maybe they're not, as active every day, but that one day a week, they're super active. Well, I challenge you that your client, if they need it on their most active day, then they still need it. And so that's something that we have to remember and really advocate for our clients. I think that what we've seen just even throughout the keynote session and the first session I talked to, it was a lot about advocate, and teaching our clients to advocate for themselves. So that 65-year-old grandparent babysits once a week, they're very active, and we need to ensure that they have what works for them. So maybe somebody wants to go back to university and they're tired of sitting and doing everything virtually, and they want to go actually in person. So they need a wheelchair or their equipment to work for their benefit. And then last but not least is the 87-year-old who's propelling their chair to the dining hall. Maybe they live in an assisted living facility or even a long-term care facility. How are they going to get to there? And don't start yelling at me about funding and for things and people in long-term care homes. We'll talk about that in a little bit. But again, just remember how much that active user term is really thrown around in our industry. But it's not just a young person. So it's that older individual who is active in their own right. And we don't want to be discriminatory because maybe they don't seem to meet what we think is active. I do think we sometimes, or maybe not us, but I think often our funding sources hold wheelchair users to a higher standard for what they consider active. And I think we need to continue to advocate and push so that our clients have better access to the equipment that's going to help them. Soapbox, I apologize. So then let's talk about athletes. Okay, so you start getting into that like 15 to 24 degrees of camber. It's typically seen on those athletes' wheelchairs. So there's greater forces. So the same benefits and limitations don't apply. But let's kind of come back and look at it, like critique it, right? Let's do some constructive criticism on it. And the greater forces on the upper extremity and the greater energy expenditure that they have to put out, it doesn't really matter as much because those negatives, they're only using the chair for a specific amount of time for a specific activity for a specific purpose. So yeah, so it is going to be higher forces in the upper extremity when you've got the chair out at 24 degrees. But they have trainers and professionals and all these biomechanical engineers. There it is. It just wasn't coming out. Sorry. And so they're looking at this, and this is why everyday chairs are not sports chairs. Understand that athletes' chairs are very sports specific. Your client who's playing a court sport like basketball or tennis, it's not going to be the same as if they're playing, if they're doing track and field or racing or something like that. And we are not here to talk to you about what is recommended for athlete's chair. We're here to talk about everyday chairs, but it is a population there. And so we want to ensure that we are giving them their time to look at it. Next, we could talk about the aging client. Okay, so here we're talking about the perceived stress, physical propulsion. It's significantly higher for the elderly population. Okay, and I think we can understand that. For the elderly client, if we can look at some of those little tiny details like camber, and possibly maximize their independence, or maybe we can look at camber and it helps to qualify them for a higher level chair, then that's great. Their living environment probably has enough widening in the doorways that we can add a little bit of camber onto that chair. Skilled facility, nursing home, retirement village, those types of things. It's really not as big of a deal because usually those places are built and they're accessible. Hand protection. Erin did an entire slide talking just about hand protection because it is so important. And when you talk to a lot of people, when we talk about elderly clients, it is vital for aging skin, right? We know, you've seen the elderly population, you see their hands, they're bruised, they've got all of these things. And that's because their skin, they have less fatty deposits, they have less blood flow, they're at a higher risk for damage and slower healing. So I'm going to introduce you to Helen in this photo, and Helen happens to be Erin's grandma, and she's had a stroke, and here she is sitting in a chair that cannot be optimally configured to her. And unfortunately, in many areas of the world, this is the best she can get. So if you, the therapist, have the opportunity to recommend a fleet sale, possibly into a nursing home or something like that, choose something that maybe can be more adjustable, that can be individualized to the client, because those small differences can make a big difference. And having the higher level chair where camber can be an option could allow for that geriatric client to be a little bit better and more efficient in their pushing. So if you really have a passion for geriatric population, you can pop into my next session, which is at 2:15, where we talk about changes with age and a geriatric prescription for ultra lightweights. But again, let's just think about all of these things as we continue to move. So this is our geriatric client. Now let's talk about pediatrics. We're going to swing back to the other end. So here we have, due to quickly growing children and a long and limited funding process, I don't think anybody disagrees with that. Children grow quickly and funding can take a while. A common plan is for children to grow into their chairs. So as a pediatric clinician, I really hate almost every part of that first comment. But unfortunately, it is a reality. And sometimes introducing a little bit of a higher degree of camber is a way that you can offset all of that growth that has to be built into it. We could have many conversations about growth versus, making a chair that grows with the child, fit the child. But let's just, bring it back to every bit of additional width that you're building into that chair for that kid to grow into is making them less efficient with their propulsion, right? Because their arms are coming out, they're in more of an abducted position. So they can start losing their propulsion efficiency up to 10% for every additional inch that we're putting in there. So camber, if you add in some camber, it's going to allow them to have better access to those wheels. And think about it, you can add a little bit more camber into maybe a pediatric wheelchair because they're already smaller to begin with. So doorway access, some of that isn't as much of an issue. Another thing that we think about with pediatrics is turning. Sometimes it's challenging for young self-propellers to learn and figure out how to turn. So having those wheels in a cambered position to make it not only easier to access, but easier for turning is going to be very, very important. But let's not forget, both with our geriatrics and our pediatrics, sometimes we get so excited with these populations that they're actually just starting to move themselves that we forget to break down the process and ensure that they're using proper propulsion techniques. So remember, having the chair fit and function with components is one thing, but ensuring that our clients can be efficient in how they're using the equipment is every bit as important. And I think that comes into one of the provisions in the wheelchair, sorry, my brain just went. When you're thinking about the resident wheelchair service provision guide, there it is. One of the things talks about training. So we can't forget that training is an integral part. We can't just send them out there and say, hi, bye-bye, we'll see you in 5 years when you need a new chair. That's not best practice. And that's why we're here, is to learn again, to have best practices. So let's talk about gender and body composition and camber. So in that same study that was looking at elderly versus younger, this one here looks at gender difference and not really a significant decrease or a change in energy cost. So let's talk about why is it important for people with a body composition that may be more pear-like, right? A little bit wider at the hips and more narrower at the trunk could benefit from some camber. So we have to be careful with this, right? Because again, while we are trying to bring the hand rims in so that the client has a better position so they're not out here, we also have to understand that we are widening it at the base. So you have to make sure that you're using all of the tools that are out there with manufacturers, et cetera, to ensure that you're getting the best possible, setup without being too wide for their environment. So again, keeping that in mind as you look at specifically gender and body composition. So let's kind of break it down. We looked at some specific populations, but when we're in that wheelchair evaluation and we want to have, what are the really considerations when we're selecting camber? So I think we've really hit on ease of propulsion, right? And upper extremity alignment with the hand rim. So again, getting those wheels in closer, getting a better, more efficient propulsion pattern is really going to be good. That lateral traversing and inclines. I'm going to give you an example of one of our end users who shared some stuff with us specifically about that. But again, turning on inclines, ensuring that they're going to feel stable and they're going to be able to do all of the things that they want to in that environment. Client preference. The one study that we looked at everyday users really said it came down to client preference. And this will also come down to manufacturer preference. Well, maybe my preference is 3, but the manufacturer I work for or that I'm selecting has 2 and 4, right? Or maybe I want 2 and I'm only allowed to have 3. So again, understanding that client preference is one thing. 2 to 3 degrees of camber is kind of the average, what a lot of people will tell you, a lot of ATPs who've worked in the industry, a lot of ATPs who are users who have been in the industry for a long time, that's what they'll say. But you also have to look at tight environments. And so camber, while it's going to be great for maneuvering, if you are in a really, really tight space, maybe that little bit of camber is going to make your chair too wide for that space. So we can talk about that here in just a minute as well. So client education and trials. Again, I don't want any ATPs that are in here to start, getting upset when I say we should have some to try. That's not what I'm saying. When I was speaking with an ATP colleague as we were building this presentation, and I said, here's the name of the presentation. He goes, oh, so you're going to talk about how 1 degree is great, and then 2 degrees is great, and then 3 degrees is great, and then 4 degrees? I said, absolutely not. I think people would be like, please stop. I'm going to watch paint dry. But we've gone through and we need to teach our clients the benefits and the limitations, right? And then look at what the different manufacturers offer. Again, do you want 246 or do you want 0369? Again, how do you want that to work? So again, looking at the different manufacturers. Are they going to be making changes often? How is that going to be maintained? These are all very important things, and they do differ by manufacturers. And each one is going to have something, whether it's on their website, whether it's in your login portal, to have different types of documentation and things to help your client be able to realize how you make those changes as you do. Measuring the chair. This is very important. If you are not able to try that chair and you're not able to know exactly what that is going to be, either measure it or see if there's a tool out there for you to be able to have. So what I'm saying when it says trial, I'm not saying that you have to have every single chair in every single degree. But if a client has never felt camber, having a demo set up, one demo in your fleet somewhere as a supplier or as a manufacturer's rep, it's probably a good idea so that your client can actually see what that feels like, practice it, and kind of understand how that feels different, because it is going to feel just a little bit different. So with calculators. So again, this one happens to be from the Motion Composites website. There are other websites, other manufacturers that have them as well. These are fantastic tools because you can look at your model. You can see then when I put it at a 17-inch seat width, well, maybe I'm kind of in between and maybe I need to be at a 16. Looking at these types of tools is really going to help you to see exactly what that chair is going to look like. You can change your rear wheel size. You're looking at your camber. You're looking at 2 degrees of camber. Well, maybe I want to do 4. What that's going to do, it's going to allow you to look down here at the bottom and see total, how wide is that chair going to be? Again, it's available on many manufacturers' websites, different ways, possibly through CAD drawings. So again, if you have questions, ask your manufacturer's reps. They're the experts in the products that they sell. They're the ones that you should reach out to ask these questions. Funding. I sat through an hour of funding this morning. We could talk funding all day and still probably not get through all of the questions that people have. But just remember that camber isn't available on lower level chairs. So whether it's a type 1, if you're in Ontario, whether it's a K1 through a K4, camber is not available on these. You can use it in your letter of medical necessity as a justification for your ultra lightweight chair. And if you think specifically about Medicare in the United States, and that a lot of funding sources and a lot of insurance companies use Medicare as their example, camber is one of only 4 adjustable components. That's a justification for a K5. So if the environment, if the function of your client lends itself to camber, you have some justification for your ultra lightweight chair. And I think that is really, really good. So as we finish up here, I spoke with a couple end users because I think it's much better. If we were in person, we would invite you to come up and try 2 chairs side by side, one with Camber, one without, so you could try it yourself, maybe next year, maybe for your next in-service. But let's meet, first of all, Chris Collin. And so Chris Collin is one of my colleagues. And again, we were just having a conversation. He said that he's used 0, 2, and 3 degrees of camber, both currently and in his previous chairs. He liked 0. So here, let's talk about tight fitting. He liked 0 on his 15-inch wide chair because he could fit almost anywhere, but he didn't have the lateral stability. And so he liked that because he could go into a regular restroom stall and use that in a 15-inch wide chair. But he talks about how turning is substantially easier with camber. The biggest drawback is that toe in, toe out, which Aaron said very, really gave us a good overview of that. But for Chris, he said it's worth the improved performance that he gets with this 2 to 3 degrees of camber makes it worth having to really be fine tuning with the alignment. And so Aaron talked about going up slopes. So this was Chris going up an extremely high 2.5 mile incline that he did, and he had 3 degrees of camber in that chair. And he said if he not had that, every time he turned sideways to rest, he felt like he would have fallen right over had he not had that 2 degrees of camber. Todd Richardson, another one of my colleagues, he talks about how when he was first injured in the 80s, he had mag wheels with solid inserts, 0 degree camber, and he said that chair rolled like a tank. So one of the things that he talked about is, especially with active users, he said when you're going quickly, and if you're going to go and you have 0 and you go quickly and you go down to do a turn, there's a lot of forces acting on that, and it can roll your tire right off the rim. So again, 2 to 3 degrees of camber, he says, is that sweet spot. You can kind of get the benefits and have improved turning, but still not as much toe in and toe out, which I think is really important. And my final colleague that I spoke with is Jim Munson, and I loved his thing. He said back in the day, which of course we're not going to say when back in the day was, but he said that his everyday chair was his sports chair, right? And so they had to have camber, and they changed plugs and plates depending on the activities that they were doing. A lot of them would find kind of this happy medium with 4 to 6 degrees of camber. But if you're in a 18-inch wide chair, 4 to 6 degrees of camber is going to really make that chair wider. And I think it's really important to understand, like Jim says, a whole lot of camber is not needed for your everyday chair, but center of gravity is very much the most important. But he also recommends 2 to 3 degrees of camber to allow for easier maneuverability. And so one thing about Jim, this last one, every time I've been through it in an evaluation or in a teaching situation with Jim, he always talks about hand protection. He goes, Christy, it comes down to the fact that my hands don't hit the wall first. And I think that's fantastic. So just here in our wrap up, and the next one has our resources. Again, the benefits and the limitations, I think we've very clearly put them out there. And remember that the clients that can benefit, I think we've pretty much said almost anyone can benefit from it. Your pear-shaped client, your geriatric client, your pediatric client, but let's not forget about that active user and what does that mean? So we're coming to the end here. I think we're going to take some questions. But before that, we wanted to say, please come and visit us in our booth, booth 901, and visit any of the manufacturer booths. I know it's been a little challenging trying to figure out where to go, but go visit the booths. This is Aaron and myself email address. We have demonstrations specifically in our booth, and I think a lot of people do as well. And so again, going into the booths, asking them, how do I get your live chat or your product demonstrations? So specifically for our booth, if you go to live chat, you can specifically talk to us. So Julie, I think you want to give them some CEU information.
I sure do. And we have a couple questions in the chat if you'd like to talk about those while I give the code out.
Perfect. Let me see if I can find those.
I can tell you the first question. You got it, Aaron?
Was it the benefits of camber? And then there's one about leg propulsion.
Yep.
Yeah. So somebody was asking, does camber have as much positive effect on propulsion, even when propelling with the legs? Unless you have an objection, Christy, I was just going to take it.
Go for it.
I mean, there's still going to be increased efficiency. So everything in terms of like the rolling resistance being reduced because of the angle of the wheels, increased turning efficiency, those things are going to make the chair kind of feel overall lighter to the client. So whether that's leg or arm propulsion, I think those are certainly benefits for both. It's still going to redirect the forces coming up through the wheelchair. So it's going to disperse road noise, and less wear and tear on the lower extremities versus upper extremities if the chair is more efficient in propulsion. So that was kind of
Excellent.
what I was thinking on that one.
Okay, and this one, with all the benefits of camber, why would anyone want 0 degrees of camber? That's a really good question.
Yeah.
And in speaking with the 3 end users who shared their insight, 2 of which are ATPs, I believe, and one is very mechanical. It comes down to maintenance, and it comes down to whether they feel like they can manage that toe in, toe out. One of the things that is available on a lot of manufacturers' websites as well, or in their user manual, is going to be how to adjust toe in, toe out for that specific wheelchair model. So again, reach out to your manufacturer's reps if you want that. The width is, I think, another big thing, ensuring that the chair is going to go through those doorways. But anybody who's using the chair on a full-time basis probably would benefit from a slight amount of camber, just from looking at all of the things that we've discussed this afternoon. So. One more.
Once you set toe in, toe out correctly, will it stay there? Short answer, no.
Right.
Yeah. Depends on kind of what you're traversing, how hard you're riding. It's definitely something that needs to be kind of looked at and tuned up as you go. So
correct. And one of the things I think that's really important with this type of a chair, with an ultra lightweight chair, actually any of our complex rehab equipment, is teaching our users the importance of maintaining that equipment. As soon as you feel something to start be a little loosening or rattling, you're going to want to ensure that you're looking at that and tightening that up, because as soon as it starts to loosen and rattle, you're going to start having all sorts of issues with alignment and things like that. So.
And remember those kind of clinical things that can come into play. If your client comes in and they have uneven wear on the wheels, they're coming in with like that tire shouldn't be wearing as often as you're seeing them. That can just be, heads up, their alignment might be off. That might be a hint to kind of check their toe in, toe out in their alignment. Okay, one more thing about the handouts. I'm again sorry about the handouts. If you email us at education@motioncomposites.com, we will email you out those handouts. I do apologize that they seem to be corrupted on the website. So we uploaded corrupted files.
Sorry about that.
Well,
right.
Thank you guys so much.
I'd like to give out the CEU code.
Go for
Thank
it.
you, Christy and Aaron. I'm putting in the chat now. It's 7XZBVP. 7XZBVP. Thank you, everyone.
Thank you. Enjoy the rest of the symposium.
Thanks, everyone.